Okay, folks. So thank you for being here today. This is Dewey with CMAC Unfiltered. It's been a little while since we recorded last. Katie bar the door. Spring has sprung, and it is absolutely nuts. I don't know about y'all, but it has definitely been a busy spring with training and pool startups and what have you. So I'm very happy to take some time out today on this busy Saturday to talk with Dr. Michael Beach. If you are not familiar with who Michael is, he'll enlighten you in just a minute. But Michael is the MAHC daddy, right? So this whole thing centered around the Model Aquatic Health Code was really, the brainchild of Michael and the force of nature that willed this thing into existence from one degree or another, right? So, Michael, just for everybody watching who may not be familiar with who you are, can you just tell a little bit about us, about yourself?
Sure. And it's great to be here today, Dewey. I know this is a tough time. Everybody's opening up, swim season starting. But it's a great time of year. So my 4.5-year-old grandchild is just waiting for the pool days to come. Um so I started um in aquatics really in 1995. And that one of my first outbreaks, I worked for the Centers for Disease Control for 33 years, was at a really large water park here in Atlanta.
Yeah.
And, I didn't know anything at that time. But this was the era when all the cryptosporidium outbreaks, and cryptosporidium's that chlorine tolerant parasite that's been out there, kind of changed aquatics. And we're having all these outbreaks. And that first one, large outbreak, 5,000 people ill, really sent home to me kind of, wow, there's really no guidance out there. There's no information. What are you folks in aquatics pulling to try and figure out what to do? And the answer was a goose egg when I searched for it and everything. And so I think it was really important for us to, as we finished that and thought about kind of the post-evaluation debrief, what do we do? And at that point, I kind of convinced people that we need to devote some time to this kind of treated pools, aquatics, and try and help out here. And so we started kind of what we call the healthy swimming program. That's now been around for 30 years, which seems incredible, but really starting to develop guidance for what do you do? What do you do during a fecal incident? How can you protect your patrons? How can you communicate with them and all that sort of thing? I walked over to the environmental health group at CDC, to Charles Otto, who, is well-known environmental health
Yep.
specialist, on cruise ships and helped write the food code. And said, we got to work together to do something about these issues. And, Tom Lachocki, we got him involved from NSP when NSPF still existed. And then Doug Sackett from the Department of Health in New York. We all kind of teamed up. So it was a team effort across, federal, state, industry, and everything to say, what are we going to do? Because things have definitely changed now that we have these issues. And then, we expanded healthy swimming, we expanded the research being done, the data coming in, and we thought, let's do something like the food code. Food and Drug Administration kind of administers the national food code. Well, there is no jurisdiction at the federal level. And so, when Charles and I talked about it, it was let's um, let's have a national meeting. Let's bring people in from industry and, federal, state, and local public health folks, talk about what's needed. And really, the number one thing that came out of that national meeting was give us some national guidance. We know there's no regulatory authority because remember, EPA is just the fresh and marine water. There's actually nobody at the federal level overseeing pools. And so, give us some national model guidance that we can then not have to reinvent the wheel at the state and local level. We can use that. We can propagate, pick and use it however we want. And so um, that started in effort in 2007. It actually was a very long effort, arduous, but 2014 we launched the first edition, and now we've come out with the fifth edition. And I think, that's where between healthy swimming, the Model Aquatic Health Code, as part of launching the MAC, we also created the CMAC, the council that that Dewey's part of, because we wanted here, let's get a nonprofit group that can kind of oversee the updates, the technical discussion, the support, all of those sorts of things. And so that CDC doesn't have to do all of it. Let's, think about having this nonprofit to keep this relationship between industry and public health going over time. And I think it is great to look back 1920s, we're in 2026 now, and see over those years, 30 years, what a tremendous change has occurred in the industry due to a lot of the idea that we actually have to communicate with our patrons now. One of the things about the Model Aquatic Health Code is, yes, in the beginning, the discussion was around cryptosporidium, but it made no sense to come up with guidance that wasn't holistic. And so this is about infectious diseases, chemical injuries, drowning, everything that can happen in an aquatic facility, indoor air quality, etc. And then bring that all together to say, we want to make this better. And
Yeah.
this was a personal thing too. My wife is a master swimmer and my daughter was a lifeguard, all that stuff, which is I want them to be in a safe and healthy place. I want them to work in a safe and healthy place. And so I think um I'll leave it there, but I think I've got intertwined in my being is this idea that we can do better. Public
Yeah.
health can help, that partnership is important, and influence is incredible as far
Yeah.
as what, if we put our minds to it and we form the right partnerships, we can influence the country and the globe. And I think that's actually, as I look back on it, that is where we are now. And so,
Yeah.
um, yeah, it's been a really great journey.
Yeah.
Long
I, you know,
answer,
I
sorry.
remember, I remember that water park outbreak. I was early in my career, and in those days, I didn't know what I was doing. I really didn't. I thought UL was a pump brand. I
Yeah.
mean, I was that wrong. Um, but I remember hearing about that outbreak and just, good Lord, that's massive. And many of us, the industry's kind of forgotten about that to a certain degree, except for those of us that were around to experience it. But that was a mighty impetus, I think, that spurred this thing and spurred you going down, this track.
Yeah.
And
And I think, to remember back to that time, we don't think about it. It's like you say, memories fade. When I first started presenting about this, there were a lot of naysayers, basically,
yeah,
Beach, you're overselling this. It isn't as big a deal as you think. It's not gonna, we don't need to care about this and everything. And then when that outbreak occurred, it was one of those issues where this was a well thought of as a really top tier, well run water park, and that, oh
yeah,
my gosh, it can happen to them, it can happen to anybody. And then the following year, there was another outbreak, and this was of E. coli 0157, several deaths, and it made the national news. And so I went from having presentation at one of the big conventions, 20 people, 25 people, to the next year, because of the national press that came to this, was
yeah,
basically standing room only. And can you do another session after this? We can't fill it. We can't get everyone in the room. So the industry really, there was a transition point where all of the naysaying seemed, kind of dropped away. And all of a sudden was like, this is jeopardizing our business, our health and safety. Who are aquatics people? They are risk managers. This is
yeah,
this is I tried to say to people, it isn't about something new per se. This is another component of risk management that can be integrated. It doesn't mean you have to upend everything, but you need to have this on your radar. And so, we transition to, oh, we all get now by this national meeting we had in 2005, we have got to come up with something better. And that was really where the recommendation to develop the MAC came from.
yeah. I mean, it's I mean, it's definitely been an interesting road. For those watching, I was actually on the lifeguarding and bather supervision technical committee for the first edition of the MAC, and that experience and seeing what you and the entire group of professionals working on it, right, from you to Jason to Joe at CDC, all the way out CDC to all the different health officials from across the country, to the different operators, Kathy Scott, whole nine yards.
Yeah,
Um,
I'll just say, look at the front page of edition one
yeah,
of the Mac, and you will see all the membership for all of these technical committees that were
yeah,
pulled together to develop all the different segments, and then we had to kind of, intertwine them and, integrate all of them. But
yeah,
this was a cross section of who's who in public health and aquatics across this country. It was really an amazing it
yeah.
was an amazing amount of work over those 7 years to create this.
You took the words right out of my mouth too, Michael, because it's a virtual who's who. I mean, you look at that list, and whether it be public health or aquatics, and you see folks that were 100% industry leaders stepping up to help build this thing. And that continues to be, for me, one of the most enriching experiences, but also one of the most amazing experiences. Because if you look at other codes, it's like a list of 10, 15 people, right? But here we're having, with the MAC, 140 professionals,
Yeah.
much 10 times more the next closest code size. So that was just really impressive. Take us back to those early days, right? Because I know what our experiences are on the lifeguarding bather supervision technical committee. I think we were the only committee that had to have a come to Michael meeting.
Yeah, that is true. I mean, this
Yeah,
was again, you remember you got a couple of hundred people involved over a 7 year period. I mean, this was not fast. But
no,
yes, lifeguard bather supervision was a challenge because, there were some differences between different groups. And
yeah,
at that point, nobody had ever really got those groups together to say, we have got to come up with one way. And I remember, getting two versions from the group. Um, and, I just finally pulled the group together and I said, don't send me two versions. You're the
yeah,
committee. I need these integrated and I need you to agree on what's going on and what needs to be done. And and we had a special session that we called actually, and we brought in a facilitator to kind of help with that. And all of a sudden people just said, we got to stop the infighting in this part of aquatics and work together, come up with something that makes sense to all of us. And you guys did. And
yeah,
and it was, that really showed me how these multi-person national committees can really make a difference because
yeah,
that had never, as people said, that's never happened before. We could never come to agreement. And it was like, but we wanted, this CDC kind of saying, we got to have a final product. We got to move this forward. Um,
yeah,
was something that people took seriously and they wanted to make this happen. And so all of those things, the committee you were on and the others, there were challenges on all of them. And nothing was perfect at the beginning, but it was, if we try and be perfect, this will never launch. And there were multiple other um, attempts to do this from American Public Health Association and other groups over the previous decades, and it just none of them really came to the same endpoint where you kind of had this national coalition behind it. And so I think that's what really helped in this is that we involved so many people and so many experts that even at CDC, it was kind of like, oh, this is kind of making sure you got comments from a national group. And not only that, but when we put it together, we put it out for national comment and got
yeah,
thousands of comments that we then had to go back and think about how to address all of them. And so
yeah,
it was um, what happens routinely in these sorts of things is that especially at the local level, you have a few people in aquatics. They're told to update the code. It can take years. They don't necessarily have the experience, and then they call around and say, "Oh, what's your code look like? What's your code look like?" And it's kind
Yeah.
of like reinventing the wheel. And what we really heard from them in the national meeting that kind of came up with the recommendation was, don't do that to us. Give us a model that we can pull from. Take what we want, leave what we don't want, do whatever but we got to have something that says this was, you know, science-based, evidence-based, expert reviewed, and is up to date.
Yeah.
How many places are how many of viewers are in places with a 20-year-old code, 30-year-old code, because it's so arduous to get the changes made that people don't want to do it, or it just takes forever, or there's legislative blocks or leadership blocks. This, what we want this to be is an expediter. And I think, social media is uh, I guess it's a double-sided coin, but it can be really wonderful as
Yeah.
far as communication. And I love the new wording about influencer is what I consider the Mac. And you think about how to describe it. And right now it is I view it as the national influencer. It's integrated into many state and local codes, whether that's a paragraph here or an entire part or a section. It's integrated in some of the commercial codes because it's free. We don't, integrating into a commercial code, great. That means again, it's influenced, its fingers and tentacles have gone out farther and farther. And that's been done on the global scale as well, into different
Yeah.
countries using it to update their codes. And so it's not perfect. It's always going to need to be updated because of, well, when we first did it, who ever thought about surf pools? Well, those came along later. Who really thought the issues around air quality were there, but natatorium noise reduction? Hadn't really thought about it. But
No.
take your NIOSH decibel measurement app in one of those places, and you're well over 100 decibels. It's all concrete block. Um, Lagoons, now cold plunges, all these issues, basically aquatics stays ahead of public health, and public health has to identify regulatory gaps, code gaps, new things that need to be overseen, and then develop new guidance and catch up with things and get those out there so that people across the country can then, update their codes or be able to refer to specific wording and that sort of thing. So that's the idea behind it, I think, was, even though we didn't know the term at that time, is we want a national influencer. And
Yeah.
that's what we have.
Well, and I think, the influencer part, and I'm going to ask you in just a minute what surprised you the most in the whole process. But the influencer is 100% on point. I mean, even before we started seeing AHJs looking at adopting the MAC, or at least, looking at the MAC for their regulatory updates, we saw this thing spread like wildfire through the aquatic industry. It was a player from the very beginning before the first adoption in New Mexico was even considered, um, which is just amazing. And now, to see its impact. For those watching, you can go to cmac.org, scroll to the very bottom of the page, and on the left-hand side of the page, you'll see a link for adoption and support. So if you click that, you can see how the MAC has been influential, right? I mean, it's the adoption work by YMCA of the USA, the adoption of the DoD, the National Park Service, right? You look at all the various states like New Mexico, Utah has severely the MAC has significantly influenced their code. Oregon, Washington, right, with their largely mostly adopted product, right? We're seeing in Idaho and North Dakota where the states have abandoned their codes, where the local health districts, municipalities are adopting the MAC in total. We see entities like the city of Dothan in Alabama, in an area where no codes whatsoever, and the city of Dothan has taken upon themselves to make the MAC their operating requirement. for their city pools. We go on and on and on from the impacts in Mexico and Canada and Australia, the Kingdom of Saudi Arabia, Guatemala. Was it Guatemala or Colombia? I think it was Colombia, actually.
Colombia, I think. Yeah.
Yeah. It's just crazy how this thing has influenced so much and continues to do so. Here's my big question, right? In the whole process, Michael, what surprised you the most?
That's a great question. I mean, there were so many surprises and challenges, the 7 years and launching in 2014. I think the the biggest and pleasant surprise, I think, is there was a lot of issues as we were building this and starting to launch about um, competing codes with the building code people versus the MAC with public health people. And so, building code uh, overseeing the actual front end building part of it, but then really environmental health folks in the health departments are the ones who are then handed that and have to basically oversee that during the life of that aquatic facility. And there was a lot of controversy about, oh, is this other code where the building code people and the environmental health people duking it out, and they're not going to be able to. And in the end, when you listen to what's gone on, it's it's really quite good, which is the
Yeah,
building code and environmental health people have just talked about it and they've decided where the baton gets tossed. Environmental health doesn't want a plan review done by the building code people because they want to be involved in that because they have to oversee the facility. So they need to know what's going on and they need to have say in that. The building code people aren't going to be going back to that facility later to inspect and everything. And what we found is that those two groups have kind of interdigitated, discussed it, and there's handoffs and discussion beforehand. So it's much more seamless than
yeah,
initially it looked like there was going to be a lot of headbutting. And I think we've moved past that because it actually doesn't make any sense. It makes everybody's job much more difficult. So it does, it's great that, yeah, they worked it out because otherwise you're just going to have more controversy than you want. And public health people are overloaded enough. They don't need more work dealing with that. So I think that's really been a great outcome of this is bringing those groups together in discussion as we go. And, things that were controversial in building the Mac and getting it done in the beginning, all of a sudden, just,
yeah,
later on in later editions, the groups that just fought tooth and nail to stop something, all of a sudden it's like, oh, never mind. Okay, yeah, we'll do that. And
yeah,
those things have moved forward because I think people finally came to the realization that um, whether it's this is the right thing to do, this is a good public health thing to do, or we are liable as anything if we don't do it.
yeah,
In a sense, it doesn't really matter. It got incorporated, and so I think as the MAC has become the standard of care in the United States, we see that some of those controversies have just basically faded away because the data is pretty strong. This is how we should be designing things, or this is how we should be doing things. And so, we don't do it at our own risk. Is the Mac the most stringent code in the world? No. I mean, look at all the European standards and that, which are far more strict. And again, frankly, I think we are moving in that direction um, from a health and safety standpoint,
yeah,
but you can't move overnight. You can't move a manufacturer and a builder and a designer overnight. You have to adjust things. You have to change how things are designed, how they're built. And so these things come with time. And it's as Doug Sackett used to say, this is evolution, not revolution. Revolution, you write something that's revolutionary, and usually what it does is end up on a bookshelf somewhere collecting dust because everybody discards it. It's too much at one point. What you got to do is have something that people can take, one bite at a time. Okay, we get this. Or, okay, we do get that surf pools are on the thing. We have to create something, but we're not doing it um, too fast. We're doing it at a pace in which the filter manufacturers, the feeders, all these folks can design and rethink things based on the directions that they're going. And that's what we see is that people adapt. Industry moves forward, public health moves forward. And so I think that also makes it easier from an adoption and an influence standpoint, if that makes
Yeah.
sense.
Yeah. And it's not even just the manufacturers, and designers. It's also your
Yeah.
frontline folks, right?
Yep.
So, we could go with the German, we could, adopt that revolutionary approach and go with the German DIN standard overnight, and rival the Germans in water quality, which I was teaching a qualified operator class the other day, and we were talking about codes and standards, and I mentioned DIN, and I'd have no problem taking water straight out of the return line and drinking it from a DIN managed pool. I mean, the water
Yep.
quality is that good. I wouldn't do that with any of my pools. I know that much. And I'm a pretty darn good operator. Um, but the standards are just that high, right? If we went with that overnight, we'd have such a massive knowledge gap. And I think one thing about the Mac that is cool is that it moves at the speed of education. You
Yeah.
know, it really
Good
does.
point.
Moves at the speed of education. And it's going at a fast enough pace to drive change for the good and drive effective change, but a slow enough pace to where the people that are having to do the day to day are able to keep up with the advances.
Yep. I mean, it's that we can learn a lot from the global situation and everything and those DIN
Yeah.
standards and everything. As you say, it's the speed of uptake, speed of education and everything. But think about things that they will come. Chlorine dioxide. I mean, from a cryptosporidium standpoint, that's how you fix a lot of things. How do we
Yeah.
use it and how do we do that safely in the US? Other countries do. There was a change request in the MAC at one point where it was going to be put in by one of our European colleagues for the MAC, in which if they could maintain water quality of X, Y, and Z, we would give them a break on the amount of chlorine that they had to use. And
Yeah.
if you have these DIN standard type pools in Europe, they run at a much lower chlorine level because they don't have the same demand, the chlorine demand, because the water is just better quality.
Yeah.
And so, it was one of those change requests that, again, only if you maintain the water of this quality would you get this kind. And the membership could just not wrap their head around that. It actually was really disappointing for me because
Yeah.
I had worked with this person to kind of get this submitted. But I think incentives, that's incentivizing people.
Yeah.
If you want to spend the extra money that it would take to do this, why not get a reward? Which is there's no need to be running your disinfectant levels the same way. And other you could make other changes as well, but let's incentivize people to move in that direction by cutting them some slack on things that actually in a pool operated, maintained at that level, you don't need some of these things. We've
No.
we kind of have we have high chlorine levels because we're trying to overcome not so great operation. And that, we can do better. And so I think the future will see those things slowly move into the Mac as time, as we catch up with those sorts of things.
Yeah. For those watching, just and Michael too. I haven't told you this, and I've got to follow up see where it's at. But that approach, that European approach, is being introduced in Texas, um, around the Dallas area. I don't know if the health agency actually checked off on it. I've got to follow up, But there's a company that was trying to build a center to basically DIN standards. So it's coming. It's here. You mentioned chlorine dioxide. We've got a couple of, chlorine dioxide based approaches that have hit the U.S. market last couple of years, which are interesting. And I know some individuals have some umbrage with that, and rightfully so. But you're right on crypto. It's a massive, massive, massive difference from just regular chlorine, right?
Hmm.
So for
And we
those
have to get
watching,
EP,
right?
yeah,
Yeah,
we have to get EPA on board and
yep,
that sort of thing.
absolutely.
So, um,
For those watching, right? What's the difference in, we keep talking about Germany and the DIN standard, right? So it's the DIN standard, it's the Ostrom standard in Austria, even the PW tag stuff out of Europe, which is kind of in between, right? So that's in England. That's between where we're at and where the DIN standards. But if
yeah,
you wanted to build,
for the Pew tag standards, yeah,
yeah, PTAG,
we talked a lot with them while they were
yeah,
developing things and kind of exchanged ideas around the Mac and that sort of thing. So we were
yeah,
pretty in good discussion there.
yeah. But just an example of what a German pool would look like, right? So right now I'm in my office. We've got a water polo tournament going on in a 50-meter pool. In Germany, that 50-meter pool would turn over in 2.5 hours. It would have deep sand bed filtration with a coagulant, meaning that they're getting drinking water level filtration at 1 micron. They're basically capturing bacteria. They're running ozone as a secondary disinfectant. The air quality stuff is just out of sight, and their max chlorine level is zero point 0.6 ppm. Something else that we cannot ignore when talking about Europe versus us is showering. Um, kind of the approach we have, and I don't have a better way to put it, right? We have the approach of in the US, I am clean. I don't need to shower. I'm not going to make the pool dirty. In Europe, the approach is I may be clean, but there are other people in the pool. I need to make sure I don't contaminate the pool. And that's probably a good way to put that. So it's definitely worth looking into, if an operator watching this is curious about what those standards are.
Yeah, and I mean, the Dutch group has really collected some good
Yeah.
data about what's coming off of people. And these aren't people that have been exercising or working outside for 8 hours at 90 degrees. This is just regular folks. And I mean, whether it's on
Yeah.
your hair, on your body, there's significant amounts of bacteria, oils, etc., coming off. We just don't need to put that in the pool. And
Yeah.
showing also that a very short rinse can actually make a big difference as
Yeah.
far as removing a lot of that. And that's actually why the rinse showers were incorporated into the Mac, is because they can make such a big difference, especially if those goo balls that go into filters and that sort of thing to take all the oil, suck up all the oils and everything. You can remove a lot of that before it gets in the pool. And the more data that we collect about that sort of thing, the clearer it is that um, you know, you really start talk about hot tubs. You
Yeah.
really
Oh,
want to, they are
mm,
not a bathtub. So,
no.
as people tend to use them, they really want to basically hose down before you get into one of those because
Yeah.
there's very small volumes and you can contaminate so quickly. And all of that sort of thing is all data based. We've got data to show what's going on. We know what to do in those sorts of things. So we just need to keep influencing people to up the standards, and then we don't see in the hot tubs at least, the Pseudomonas outbreaks, the Legionella outbreaks, and that is you can't have a spa that you don't maintain. That just is it becomes dangerous because of the higher water temperatures and the potential pathogens that can be in there. You
Yeah.
really need to make sure you maintain your residual. You don't have a biofilm scum on there because both Pseudomonas and Legionella are biofilm organisms. You run into problems when people get lackadaisical about operation.
Yeah. Especially in spas. Good Lord.
Yeah.
Good Lord. Well, Michael, we've been talking about 30 minutes now. I'm about to have to go load some chlorinators and check a balance on a pool and make sure we've got good PPE before we start up. Um, What's so before we go, right? What's a message you want to get to our readers about the Mac and about CMAC and about this whole thing, right? What's your final thoughts?
The Mac was created to help all of you. The CMAC was created to help keep that up to date and on target. And Dewey is technical consultant extraordinaire. Um, Join the CMAC. Bring your voice to the table. Tell us what the issues you're running into are. Um, if they aren't addressed in the Mac, let's make sure they are addressed in the Mac. Um, and I think that's what's happened. We see a specific type of outbreak. Oh, it happened because we didn't have this type of interlock. Well, nobody really did. But now we know
Yeah.
that you can do it this way and prevent those, the chlorine gas exposures, when you're continuing pumping while you're um, pumping chemicals while the pool pump is off. Those all come from discussion, from membership, from you telling us what you're running into. So if you're frustrated about something, if you're running into issues that you think this isn't really good, what do I do? Call Dewey, but let us know and join the CMAC and really help us do this. It's people like you. I mean, all of these folks that were involved in developing it, it was people stood up and said, I want to be part of this. I want to make it better, and I want to have my say. I want to be heard as well. So if you want to be heard, join the CMAC, join us. I think this is, uh, I'm a public health person. This is what public health is all about.
Yeah.
Outbreaks, data, come up with prevention measures, improve prevention measures, and measure that it makes a difference. That's what public health is from, beginning to end. And so join us in this journey. It's not over. This is continuous improvement process. Join us and spend some time on this journey making things better, and it'll make your job better too. Thanks so much for having me today, Dewey.
Michael, I think that last line, I think that's a great place to end on. So, Michael, thank you so much, folks. Go to cmac.org, join, get involved. We need you. We want your input, right? More than anything, because our cumulative efforts make everything better. Michael, thanks so much.
Thanks. And have a
Happy rest
great
of your Saturday.
and great swim season coming. Okay.
Yes,
Take
yes,
care.
absolutely. See y'all next time, folks. Thanks.